This presentation will demonstrate the major skeletal features of the thorax. The thorax is an osteocartilaginous cage which, with the skull and remainder of the vertebral column, forms the axial skeleton. It consists of the sternum, 12 pairs of ribs with costal cartilages, and 12 thoracic vertebrae with intervertebral discs. Associated with it is the pectoral girdle of the upper extremity, which is part of the appendicular skeleton. Functionally, the rib cage acts primarily as a respiratory bellows, but it also gives attachment to muscles of the girdle and upper limb, as well as to those of the neck and head, abdomen, and back. In addition, it protects the heart and lungs. The latter lie laterally in the pleural cavities, and the former in the central area, or mediastinum. The lower lateral and posterior parts of the cage also protect abdominal viscera, such as the liver on the right, and stomach and spleen on the left. The rib cage is conical in shape and wider below than above, so that the maximum transverse diameter is at ribs 8 or 9. It is also shorter anteriorly than posteriorly. And compressed anteroposteriorly. The anteroposterior diameter is particularly reduced in the midline by the bodies of the thoracic vertebrae. The overall contour varies in different individuals from a long, narrow to a short, broad type, which affects the loin or costo-iliac dimension between the lowest rib and iliac crest. The rib cage has an inlet above and an outlet below. The inlet is kidney-shaped and slopes up and back. It is bounded by the upper border of the sternum, first rib, and body of the first thoracic vertebra. The apex of the lung and pleura fill the inlet laterally, and the trachea, esophagus, and great vessels medially. Note that the lung apex reaches up to 3 centimeters above the first rib and clavicle. The outlet is the widest part of the rib cage and slopes down and back. It is bounded by the subcostal margin anteriorly and laterally, and by ribs 11 and 12 with the body of the 12th thoracic vertebra posteriorly. The outlet is filled in by the thoraco-abdominal diaphragm, which is a sheet of muscle attached to the skeletal limits of the outlet. It bulges up into the thoracic cavity as a cupola on each side, reaching the level of the 5th rib on the right and of the 5th interspace on the left. The sternum has a manubrium, a body, or gladiolus, and a xiphoid process. These parts are united by cartilage, but may fuse after middle age. In place, the sternum slopes down and forward from the root of the neck to the xiphoid in the epigastric fossa, or pit of the stomach. The manubrium is about 5 centimeters long and has the outline of a truncated triangle. Its upper margin is at the level of the lower border of the second thoracic vertebra, and its lower margin at that of the fourth. It articulates with the clavicles supralaterally, and between them forms the lower border of the suprasternal or jugular notch. The body of the sternum corresponds to thoracic vertebrae 5 to 8. At its junction with the manubrium, there is an obtuse sternal angle. This angle of Lewis is marked by a transverse thickening of the two parts. The second rib articulates laterally at the angle, from which it can be identified in the living subject. The xiphoid articulates with the body at the xyphosternal junction in the infrasternal angle between the left and right subcostal margins. It is cartilaginous in youth, but ossifies later. It lies at the level of the body of the ninth thoracic vertebra. Each of the 12 pairs of bony ribs curves from the vertebral column out, down, and anteriorly on a course that increases in obliquity to the 9th or 10th. Each rib forms a progressively wider curve. Each bony rib ends in a costal cartilage. These increase in length from ribs 1 to 7, and then decrease. Note that these cartilages may calcify with increasing age, reducing respiratory mobility. Note also that in rachitis or rickets, a calcium deficiency disease of children, enlargement of the ribs at the costochondral junctions occurs, giving palpable projections called a rachitic rosary. Ribs 1 to 7 increase in length progressively. All reach the sternum by their costal cartilages. Hence, they are called true ribs. The manubrium of the sternum shows a pit on each side for the articulation of the first costal cartilage. This lies just below that for the sternoclavicular joint. The second cartilage joins the sternum at the angle between manubrium and body. The body of the sternum shows 4 pits for the articulation of costal cartilages 3, 4, 5, and 6. The 7th cartilage articulates between the body and xiphoid. Ribs 8 to 12 decrease in length progressively. The costal cartilages of ribs 8, 9, and 10 do not reach the sternum and are called false ribs. They join the cartilages of ribs 7, 8, and 9, respectively. With the cartilage of rib 7, which does reach the sternum, they form the subcostal margin. Note that there may be other variable fusions, especially between cartilages 5, 6, and 7. The costal cartilages of ribs 11 and 12 end freely. Hence they are called floating ribs. The 3rd to 9th ribs are typical in that they show similar features. Each is convex with a slight twist and has a head, a neck, and a tubercle, and a shaft or body with an angle. The shaft has a smooth upper and a sharp lower border, and an internal and external surface. The shaft terminates in a hollow for articulation with its costal cartilage. The head has an upper and lower facet which meet at a ridge. The facets articulate with the bodies of 2 adjacent vertebrae, which are the corresponding and the one above. For example, rib 5 articulates with the 5th thoracic vertebra below and the 4th above. The neck is about 2.5 centimeters long and joins the shaft where the tubercle occurs on the external surface. This tubercle articulates with the tip of the transverse process of the corresponding vertebra. The angle of the rib is at the maximal curvature near the posterior part of the shaft. A twist on the long axis also occurs here. The angle of the first rib is at the tubercle, but it gradually moves away from this down the rib cage. Note that the angle is the most likely site of fracture. Between one rib and its successor is an intercostal space, occupied in life by the internal and external intercostal muscles that pass from rib to rib. Each interspace is named for the rib above. Thus, the interval between ribs 5 and 6 is the 5th interspace. The inferior border of the rib shaft has a costal groove on its inner aspect. This has upper and lower lips. The latter forms the sharp inferior border of the rib. These lips give attachment to the inner and outer layers of the internal intercostal muscles. Between them, in the costal groove, run the intercostal vein, artery, and nerve. The outer part of the inferior border also gives attachment to the external intercostal muscle. The smooth superior border also has external and internal lips for attachment of the external and internal intercostals. Ribs 1, 10, 11, and 12 are atypical and show special features. Rib 1 is flattened from above down and is broad. It is the shortest except for rib 12. Its upper surface shows a scalene tubercle for the insertion of the scalenus anterior muscle. This separates an anterior groove for the subclavian vein and a posterior groove for the subclavian artery. Note also that an additional cervical rib may occur above the first, articulating with the 7th cervical vertebra and extending into the posterior triangle of the neck. Such a rib may give neurovascular symptoms in the upper extremity due to pressure on the elevated brachial plexus and subclavian vessels. Rib 10 has only one facet on its head, as it articulates with the 10th thoracic vertebra only. However, it does have a tubercle. Ribs 11 and 12 are similar, but do not have a tubercle, as they do not articulate with the corresponding transverse process. The thoracic vertebral column of 12 segments is convex posteriorly. Characteristically, the spine of each vertebra is long and directed almost vertically downward, so that its tip is at the level of the body of the vertebra below. The spine of the first or of the 7th cervical is particularly prominent. Note that the angles of the ribs are almost level with the tips of the spines. Hence, a supine position is stable in man, unlike in most other animals. The 2nd to 9th thoracic vertebrae are typical. Each has an articular facet on its transverse process for the tubercles of the ribs. They also have demifacets on the upper and lower bodies that, with adjacent vertebrae, form full facets. The head of a rib articulates with the superior demifacet of its corresponding vertebra and with the inferior demifacet of the vertebra above. In other words, each vertebra articulates with the corresponding rib and with the one below. The 1st, 10th, 11th, and 12th vertebrae are atypical. The first has a full facet above for the head of rib 1 and a demifacet below, which with the upper one of vertebra 2 forms a full facet for rib 2. The bodies of the 10th, 11th, and 12th vertebrae have only a single full facet for the heads of the corresponding ribs, and the 11th and 12th have no facet on the transverse process, since ribs 11 and 12 lack a tubercle. The pectoral girdle, consisting of the clavicle and scapula, is associated with the rib cage. The clavicle runs from the sternoclavicular joint medially to the acromioclavicular joint laterally and overlies the first rib. The clavicle serves as a strut to keep the upper extremity clear of the trunk for free movement. The acromion of the scapula overlies the shoulder joint and passes posteriorly and medially to become continuous with the spine of the flat triangular scapula. The spine separates a supraspinous from an infraspinous fossa on the posterior surface. The anterior or subscapular surface covers ribs 2 to 7. The superior angle of the scapula is at the level of the spine of the 1st or 2nd thoracic vertebra, and its inferior angle at that of the 7th, or at interspace 7. Between these angles is the vertebral border, with the spine terminating at the level of the 3rd thoracic spine. The scapula also has a superior and an axillary border, which meet at the thickened lateral angle or head of the scapula. This forms the glenoid fossa for articulation with the humerus. This concludes the demonstration of major skeletal features of the thorax.